I'm a Survivor is a part of a month-long observance and celebration of National Minority Health Month. This presentation is brought to you by the Neighborhood Community Development Center of the Urban Mission and is funded by the Ohio Commission on Minority Health. Thank you so much for joining us, and we know that you'll enjoy this message of hope.
Whether it's our stories, the warmth of our laugh, or our family's secret sauce, we all bring something different to the table. So make some space. The power of connection is waiting right outside your comfort zone. Learn how you can help strengthen your community at belongingbeginswithus.org/teamup.
4 things Black men should know about prostate cancer. A Minority Health Month series. 1. Black men both get and die from prostate cancer at a higher rate. The reasons are complex and unclear. Black men are 50% more likely to develop prostate cancer in their lifetime and twice as likely to die from the disease. It is difficult to untangle the various factors that might affect the risk and outcome of prostate cancer. Prostate cancer in Blacks tend to have a high biological characteristics associated with more aggressive diseases. There is evidence suggesting that this is partly related to the inherited genetic factors. 2, Black men should be screened for prostate cancer more proactively. Given the higher risk of developing and dying from prostate cancer, Black men are more likely to be saved by screening. The main prostate cancer screening tests are digital rectal exams, in which a doctor checks for swelling and inflammation, and a PSA test, which measures the level of prostate-specific antigens in the blood. 3, active surveillance. Black men and their doctors should be more cautious about active surveillance. Active surveillance is an approach in which low-risk prostate cancer is not treated with surgery or radiation therapy. Instead, it is monitored very closely for any signs of change over months or years. Active surveillance is increasingly the treatment option for low-risk prostate cancer. Many men embrace this approach because the side effects of treatment, usually surgery or radiation therapy, can be significant. Black men, however, are more likely to develop more aggressive prostate cancer. Because of that, active surveillance may be less appropriate for Black men. As with screening guidelines, there is little evidence to provide guidance one way or the other, because Blacks have been underrepresented in active surveillance studies as well. And 4, Black men must seek out preventive care. African American men may be also harmed by racial bias in preventive care, as they are less likely than white men to be offered the option of having a PSA test, and are more likely than white men to be told that the benefits of the PSA test are uncertain. Additionally, a recent study found that African American men diagnosed with early stage prostate cancer were less likely than white men to receive any type of treatment for their cancer. 4 things we should know about Black men and prostate cancer.
I'm a survivor. I'm not gonna give up. I'm not gonna stop her. I'm gonna work harder.
Good evening. I am Dr. Vanessa Palmer, and I am a nurse, and I have developed a breast health program that I have introduced to the community working with Urban Mission Ministries here in Steubenville, Ohio. Today, I'm going to talk to you about Get Your Screen and breast cancer prevention. Let's start with the purpose for this discussion. To promote early breast cancer screening, to enhance prevention, increase the likelihood of detection, decrease occurrence of the disease, save lives. And after the purpose, I also want to talk to you about barriers. So let's go to the next screen. What barriers would you say hinders you from getting your screen? As you can see, the word fear is highlighted here. Why? Because what is understood in evidence-based research or by healthcare is the concept of fear, misconceptions about screening provides a barrier for many African-American women, thus hindering them from getting mammograms. I want you to know a person's behavior is prompted by their own personal beliefs and perceptions about a disease. In other words, if a person believes and perceives that there is a problem in their life, that a disease will cause them harm, then they're more likely to practice behavior that is conducive for prevention. And then on the flip side of that, if they decide, I can wait, it's no big deal, what's the rush? Then that's when we get into problems, and that's when prevention is not practiced. Let's start with the first barrier, fear of results. What are my chances getting breast cancer with my family history? This is a very good question. Understanding if there are women in your family that have had breast cancer, your chances of having a gene mutation that is called BRCA1 or BRCA2 predisposes you to this gene, and thus making it easier or you more at risk for breast cancer. And what we also understand is this, that women, Black women, are dying at a greater rate due to breast cancer in the United States. In the United States, breast cancer is number 2 for women dying, and women are of color, Black women are dying greater than white women. And what we also understand is that women, Black women, African-American women, age 23 and up are predisposed to what is called triple negative breast cancer. And this type of tumor has a poor prognosis. So understanding your family history is paramount. Let's go to the next slide. Fear of surgery. I don't want to have a mammogram. I don't want to find out if I have cancer. These are questions, these are statements, because if I have it, then my breast is going to have to be removed, and then the cancer is going to spread. What I want to say about this, again, misconceptions, listening to hearsay, listening to myths, and not really sitting down with your primary provider to understand exactly what will happen with you if a disease process is found in your body. And not only that, early detection is what we want. The sooner we know what is happening in your body, the better it is for you. Next slide, fear of losing hair. For the African-American woman, our locks, our natural locks, they mean a lot to us. They're part of our identity. And so women may say, if I get radiation, this will cause me to lose my hair. And this is something that would happen to any woman, white or Black or African American, that is traumatic. But what I want you to understand is this. The sooner we can understand what's happening with your life, the stage of breast cancer, if we are finding this, the better it is in determining what treatments, what we need to do, what modalities. It might not require radiation right off the bat. So that is why an early screen is necessary. The next slide, fear of radiation. A person may say, I've already been exposed to a lot of radiation. I don't want another X-ray. Again, the stage where you are with the breast cancer disease will determine if radiation is necessary. That is why early detection is important. And then this particular slide, talk to your provider. I can't stress enough the importance of having a provider, having the ability to talk to a provider, and establishing a positive relationship, because you'll be able to talk about family history, risk, benefits of getting screened, and this is called informed and shared decision making. When you trust your provider, it means there's confidence involved. It also means empowerment for the woman. We want Black women, African-American women, to feel that they are empowered to take care of themselves. Screening tests, 2 types. First is screening mammogram, no signs of breast disease, but it is the regular screen X-ray with a mammogram screen machine. However, a diagnostic mammogram is necessary if there is a problem. If you get a regular X-ray of the breast with the mammogram screen machine and they find that there is breast tissue, that there is a problem, they detect, we see something, we have to look further, then that's when a diagnostic mammogram is ordered. Things I can do to help myself. Examples of healthy living. I only have 3 here. Let's start out with this. Decreasing alcohol intake. The risk of breast cancer increases as alcohol increases. Drinking alcohol increases estrogen levels in the body. And some health experts believe that through this pathway, increase of estrogen in the body due to alcohol intake requires, or it causes one to become at risk for estrogen sensitive cancers. And this type of cancer is common with the increase of estrogen in the body. What I want you to remember from this, early detection is important. I would actually use the word paramount. Talk to your doctor or your provider. Know your family history. Get your screen. Thank you.
I'm a survivor. I'm not gonna give up. I'm not gonna stop. I'm gonna work harder. I'm a survivor. I'm gonna make it. I will survive. Keep on surviving.
Please take a moment to tell us what you thought about this presentation. You can find the survey link in the comment section below.